Good morning. I want to thank Joe and Kevin and Brian for inviting me to be a part of this and talk about reverse shoulders for cuff tear arthropathy and a little bit about why we should do it and when we should do it. There's my disclosures. How do you go back? Well, we have a number of options, and I think there are different scenarios for all of these different options that we can do. And really, to be a good shoulder surgeon, you need to be well versed in all of these different things, and they apply to different patients. So it's not always the MRI. So you have that MRI, and then one patient can raise his arm, then the other patient can't raise his arm. But I always think that there's a good clue. So when the patient can't raise his arm as high as the tattooed lady can raise her leg, then it's time to do a reverse. So I was tasked, along with Peter Millett, to do a study to determine whether there was a consensus. So this is the near circle study for 2020, and the near circle was thought about by Frank Cardasco, and it recognizes service to the Shoulder and Elbow Society and about 110 shoulder and elbow specialists. And we're challenged every year in the near circle to get a consensus on a very controversial topic. So our year was to do the treatment of massive, irreparable rotator cuff tears. And we used the Delphi approach. This is our near circle committee, and this was published in June of 2021 in JSES. So the Delphi process, it's a widely used technique. It's based on a panel created of experts with a high level of expertise that's accepted. There's anonymous participation through questionnaires. Multiple rounds of questionnaires narrow the topic and it analyzes